Hello everyone, welcome again to the Daily Dose Plus. I am Tijan, your host for the Optimizing Health segment. With me today, I have Muhammed S Bah, who is an administrator at the Tanka Psychiatric Hospital, which is under the EFSTH, that is Edward Francis Small Teaching Hospital, the Gambia. And then on the other side, I have Mr. Ousman Demba, who is a nurse at the Edward Francis Small Teaching Hospital, but also working with No Health Without Mental Health, Gambia. Mental health has been a difficult conversation for most of the people. I think one of the most difficult conversations you could ever have. A lot of people are not comfortable having conversations with regards to mental health. So today we're just going to take time and dive into the dark clouds of mental health with Muhammed and Ousman. But before we start, you can tell us a little bit about yourselves with regards to your backgrounds towards mental health. Muhammed, let's start with you.
I am Muhammed S Bah, just to reintroduce myself as the acting matron of the psychiatric hospital that is on the EFSTH Tanka. Before actually starting or specializing in mental health, I've been volunteering with some organizations, let's say NGOs, like YMCA, that I was working with the Dimbalante project, where I've actually worked with underprivileged kids or students that were actually based in the provinces, let's say in URR and also at the North Bank region as well, where some of them, as a survey that was done, we have to look into problems like anxiety, phobias, etc., and you name them. So from there, I've actually developed a passion whilst working as a registered nurse, that is a general nurse actually. So that was how I developed the idea of actually getting involved with mental health. And growing up as well, you know how Gambia is. I mean, every youth or every young man actually will actually deal with adversities in this country, difficult situation, just to say. And through that, you have to cope. And when you look at the environment, there were no good mental health service delivery in this country. And growing up in the health system, I feel like that it's actually an edge or a place where I could make a change. So that was how everything started. And I took up the lead and actually specialized in mental health at the American International University, graduated as a degree holder, then got my postings on the EFSTH and moved to the psychiatric hospital
at Tanka. Well, definitely I want to commend you for the good job. That definitely sounds like a lot.
Exactly.
But in as much as everything that you said, I want to commend YMCA because I've also learned a little bit about mental health with them. The same Dimbalante project with regards to peace building and things like that. I've also done, I think, 3 months with them, just learning a little bit more about peace and mental health. I'll shift back to you, Ousman, so you can also give us a brief explanation to, what you are with regards to mental health.
Okay, thank you, Tijan, and I want to say again, thank you for having us today. Just like you mentioned, I am Ousman Demba. I'm a general nurse. I graduated from the American International University 2019, I guess. And why I'm into mental health, I think the time we were going to school, there's this club that you just introduced me with, No Health Without Mental Health. I think that's about my second year. They introduced the club to the organization whilst we are going to school, and some of us were able to join. And then from there, we were able to do some mental health outreaches, hard to reach areas where you know that people would be having or they are in need of mental health services, but they cannot know where to go because of the places that where they live. So this organization is basically there to go like hard to reach areas and then provide these kind of services to them, and also if need be bring in a referral to them, like where they should go if 1 or 2 things is happening to them, where they need to call on where they have to go. So I've been with them. I realized that there's so much more that need to be done in that arena than just regrouping students or regrouping only members that are interested. They see tourism as a community care-driven thing than just any an individual like trying to do one or two things. So aside from that, I think that is one thing that driven me towards coming to mental health, creating awareness and all that. And yes, besides that, now working with Edward Francis Small Teaching under the Department of Pediatrics.
All right. I am a mental health activist at some point, because even my Mr. Gambia pageant, my topic of discussion was based on mental health. Because I've realized, like I said initially, a lot of Gambians don't talk about mental health or don't understand some of the conditions that are happening to them with regards to mental health. Or at some point, we might just generalize everything and say we're stressed or we're not resting enough, not knowing some of these conditions. It's just normal for it to happen to you, right? In as much as we'll be talking about mental health, we're in a period where now a lot of people's solution towards mental health is drugs, right? So we're also going to be talking about coping mechanisms, I guess, because that's where they fall under, good coping mechanisms, bad coping mechanisms, and all of that. But before we really dive into this whole conversation, I think it's really important, to a simple level, Mr. Muhammad, what would you say mental health is, or mental wellness?
Right. That's a good question, because most of the time there's always a thin line between mental health and mental illness or mental disorder.
Right.
Gambians will always miss this too. Right. So mental health generally speaks about your psychological, social, emotional, physical well-being, where the individual can actually serve and be normal or give back to the community in a proper way. So the individual has to be just in his right state of mind, in basic, in like simple level. So the mental illnesses or disorders comes in when the individual cannot function properly due to some of the factors that can trigger your mind to shift. Let's say, for example, when we talk about someone is delusional, in a sense, it's like the person is detachment from reality. You're having fantasies of ideas. So those are symptoms that you can clearly manifest, and then someone will be like, you're not with your right senses. So if the person is showing that, that's just an example that will show you that the individual is now having some problems or issues regarding mental health. Or the easiest one can be, let's say, the commonest one. People do have phobias, for example, or general anxiety disorders, and the list goes on. But just to give the viewers to understand, there's always a thin line between these two. Yeah, and there are some illnesses or disorders that will qualify a mental condition based on the duration as well.
So some of these things are just happening to you for a period.
Exactly. Right. So let's talk about, for example, depression. Right? Most Gambians don't believe that they have once been affected or were a victim of depression. They just think they're on a stress level, like you rightly mentioned. So with the upgradation of the ICD-10 to 11 now, or let's say the DSM-5 to the DSM-6.
Those are things that we don't know, me and them. So you might want to tell us what DSM is. But, so the ones that we know is when you get delusional from the TikToks and all of that, we just say you are delulu. But past that point, we don't understand some of these explanations.
So like when you look at the ICD 11 now, it's been upgraded. It looks, it's actually talking about the international classification of diseases under the United Nations category or the WHO. So when you look at the DSM-5 or the DSM-6, it's talking about the Diagnostic Statistic Manual under the American system. So there are different patterns, but Gambians don't actually stick to one. We're just using both. So, but the ICD 11 or 10 is much more easier to understand and is simplified without codings. So when you look at depression, let me come back, because it's a common issue that I think we need to talk about today, and we need to highlight to the viewers to understand. The ICD-11 now is telling you if you experience some of the signs and symptoms of depression, just 3 of it or 4, which I'm going to list. Let's say withdrawal symptoms, like lack of interest in some activities that you were once involved in, let's say football or hanging out with friends, for example. All of a sudden you don't like it. And then low mood, or you're having mood swings. So then loss of weight, for example. And then you're always angry or irritated or agitated, right? So they're saying if you have to experience these signs and symptoms clearly for 2 weeks to 3 weeks, that means you're actually on the early onset of being diagnosed as a depressive victim. You understand? So the list goes on, because when you look at the depression, it has 3 categories. You have the physical symptoms, you have the social, you have the behavior, like psychosocial, and then the list goes on. So that's how you can actually classify the individual on each of the stages.
So what are some of the symptoms related to depression?
Yeah, like I just rightly mentioned, those 4 are actually
related to depression.
Depression.
But how about some of the behavioral things that people would do with regards to when they're depressed?
Right.
You know, some cannot even get themselves out of the bed. And sometimes they want to know what the solution to that might be.
That is right.
We might have not got in there, but in as much we can just drop it as well.
Exactly.
So how would you find help if you were depressed or anything like that?
Yeah, but let me just clear the first part.
Definitely.
Most of the time, on statistics-wise, even in Gambia or worldwide, depression tend to affect more of women, right? Because of the genetic makeup.
That's interesting.
Yeah, because of the genetic makeup. And also they're so emotionally attached and all of that.
Yeah.
So, but there's a saying that Gambians will always say, men should man up. So that has been a point wherein even if a guy is actually depressed, you hardly see it.
Wow,
Go exactly. Yeah.
If you complain about mental health at some point during this time of the period, some of the ladies might call you a baby, since that is
exactly.
Since that is what is trending these days. But let's get to you. From some of your explanations, I realized you've gone to a different portal of what mental health looks like. For Mr. Muhammad right now, he's more a little bit focused on tanka, which is really important, because I feel like a lot of people, once it gets to tanka, they think that's over.
Exactly.
You cannot be sane again. So we're going to get to that.
Sure.
But also, in as much as it's important, a lot of people in the community setting don't believe in mental health, don't see the problems associated to it. And like Muhammad rightfully said, they'll just tell you to man up if you are a guy. If you're a lady, they might just think you're possessed or something like that. What is your experience dealing with people with regards to mental health on a community level? How do people process things? If you have a story, we might want to know some of these things, the experience as well.
Thank you for that question. I think everything had to come down to acceptance. The Gambia hardly, the boys, let me, because he made mention of something that is very African, especially Gambian. Like you would have this feeling of, being down,
sadness,
depressed, sad,
anger.
but because you are a man, you need not to show it. So I think it all had to come down to that, talking from experience or talking from our background. And there are so many things happening actually right now that are affecting not only women, but just since the conversation is pivoted on women, women's health, women's mental health, and women and all that. So we swayed ourselves from the whole definition and conversation. As men, we are predisposed to many of these things that women are actually exposed to. And as men, we have a different threshold of how better we keep ourselves comfortable, how best we keep ourselves, or how can we accept crisis. So let's say, for instance, you, Tijan, your threshold is deeper than I am. Maybe just for simple hulo nini, you can keep that right, and it would not affect you. It would not withdraw you from any of your activities that you are, you are fond doing. But let's say when it comes to me, I might not be able to take that. Like just a little bit riff with my girlfriend would actually hit me hard. So I need to talk about it. I don't have to see it to be something that is weakness. I have to talk about it and accept that this is something that is affecting me.
Definitely.
Exactly. So appreciating yourself and trying to compose yourself within that confine to be able to talk about it. Talking to is our problem. Hardly even and then so I had to come back home again because they are shy to talk to the doctor or their caregiver about what is actually disturbing them. So it all had to come back to our realities as a Gambian. Not talking about things, not in front of your needs. Exactly. So it all had to come down to appreciating what you're actually going through, and know that probably if you don't talk about it, or if you don't find solutions towards that kind of things, maybe probably if those thing progresses, like depression would come, it might actually get you to certain things. But coming back to our community again, let's say substance abuse, especially substances that are very common in our communities, let's say ganja, marijuana, and nowadays pills.
See, when we come to drugs, I know a few drugs that I can list, right?
Okay.
I've gone to the point where I heard there's a drug named Ginabas.
Yeah.
That's
Gina?
supposed to,
Yeah,
Ginabas.
Ginabas.
I've never.
That drug is supposed to make you, I don't understand. If it's supposed to make you run fast like Ginabas,
Let me just explain.
or it's supposed to run you crazy faster than Ginabas could run.
Right.
Before we really get to the drugs, right? A lot of things is associated with mental health.
Right.
Part of which is stigma. I personally think a lot of the problems that mental health is facing is because of some of the structures we don't have with regards to finding help or necessarily learning to understand some of these conditions, right? But in as much as all of that is really important, a lot of people are not proactive to finding information about mental health because they don't want to be stigmatized. They don't want to be labeled crazy, where it's just sad, but a lot of people just call a lot of people crazy. And I always said, I don't call anybody crazy, I just think they might have a mental imbalance with regards to their chemistry in the brain. But explain to us a little bit, how do you assess yourself to know you might need help, right? And when you do need help, who can you really talk to? Can I just call on Muhammad and just try to find out a few things? Or is there some place I can work? Or if there's a social media page that you can go to? It's really important because in as much as we'll be talking about all of these factors and the bad things that is happening, going later on into the show, we might want to tell people from here what are the solutions, where they could walk into, how they could help themselves, how they could just figure out what they think might be wrong with them.
Right. So let me just start with saying, when I was posted to Tanka, what I've seen there was people within the mental health field feels that when they leave the hospital, mental health stops in Tanka. They don't see it as like a general problem for the public. So as an advocate and a specialist in it, I do really advocate for mental health and psychosocial support. And like you rightly mentioned, right now, before Tanka has the stigma, let's just call it like that. That's actually the code name. I will not be here sugarcoating it. But now things are changing and it's actually getting better. That we're trying to blend in mental health and psychosocial support within the system. That is, we have departments already been separated within the unit that you have to do. We even have clinical psychologists, Ms. Beverly Jordan, and the hospital I've been seeing her around because I've been really asking her to go around with wards and see how some people that might need help within other departments. And we also have social workers as well. And then, so when you, for example, we have our referral pathways, but I'll explain that later. When you come in, you'll be assessed because we have psychiatrists there now, 3 Cuban aided doctors, and also a Gambian, that is Dr. Tijan, who is away at the moment. So you have trained degree holders like myself and other senior nurses as well. So you will be evaluated on a mental state evaluation state and then try to prioritize and see whether this person really needs drugs, at what stage, at what level. And we are really advocating for counseling and therapy now. So that is why I really want to share this for people to understand, the viewers to really understand now. It's a safe zone now for people to actually walk in. Because I can rightly mention that because in statistics, we have really improved and we have really seen a lot of anxiety cases last year and depressive cases. On a general note, they only needed counseling and therapy, and it really worked out for them.
It did.
Yeah, we had a lot of successful stories.
That's good.
And along the page, we also have, partly, I do volunteer with IOM, because I was telling him this morning, yesterday we just received 87 migrants from Libya via IOM, and there are others that are about to also land as well, where we had to enroll them and give them, evaluate them, and also try to put them on a mental health and psychosocial support scheme that they will need. So it's not only Tanka now within the system, but IOM as well is also helping out in making sure mental health and psychosocial support is really in the system. And you guys might be happy to know that there's a program going on at the college as well. I think you know about it. Of recent, they're training students on mental health and psychosocial support. At a diploma level. So we hope that might move to like a degree level where people will actually, the more we have the human resources, that's how everything is going to change. So I will still have to point back to the stigma you're saying. Gambia, we have a problem. I always say it in any platform that we go. And now things are changing because I can gladly say that I will give credit to the National Human Rights Commission that there was a conference that we had with them where we had to draft an advisory note to the government or the National Assembly for them to look at our Lunatic Act. At times I'm ashamed to call it that way because it's not supposed to be called that way.
Why is it called the Lunatic Act?
That's my point. Because those acts were drafted back then during the colonial era, right? And that is still in use because it has not been changed.
So if I understand properly, what you're trying to tell me is the structures that are set to support mental health is what is called the Lunatic Act.
Yes.
Which is crazy because
So when you look at it,
people are labeling health as lunatic, that is a problem.
That is where everything.
That is where stigma starts from.
Thank you. So that's why I say I have to point this out for people to know that things are changing.
Yes.
Because when I we posted there, these are things I have to look into. Because the act is telling you if a mental health victim is being affected, you can call the person an idiot. That's the name on the Lunatic Act. And to me, that's not right. You can call a whole human being because the person is sick. You're calling the person an idiot.
If we're being honest, that's more of a segregation than anything.
Exactly.
But if we actually think about it, the good part is, a little bit is, our generation, I think, is ready to change a lot of things.
Exactly.
And that's why the lunatic, the name itself doesn't sit right.
It doesn't sound exactly. So you can see
If I want to call out under the government, we're going to talk about something else. But we already know we don't have proper structures with regards to anything that is of health in this country. But mental health is really, really important because, like I said, when I was doing my mental health platform for my pageant, I've realized some of the statistics that even some of the studies with regards to mental health were last done in 2013, which is like 10 years ago. So what I understood from that is, how I saw it is, for a whole 10 years, nobody really cared enough to actually find out what is really happening to the youth. You know, what their problems is, what solutions they could have, or what they're really facing, right? But also, in as much as we were talking about some of these systems, some of the problems, what do you think happens on a normal basis that's like a good way that is happening that people could use to find about mental health? Like I told Muhammad, information is really, really, really important. So now, what systems do we have in place, or what pages, or what sites would you recommend for people to go look up mental health information, how to understand some of these informations? And to be honest, even I feel upset that some of these things we're being called lunatics, because all of us have some of these problems. The world is changed to a level where
I know.
every one of us has a mental health issue. It might not necessarily be a problem, and that is where your definition of mental health and mental health disorders comes into a place. Because until it stops you from your normal activities, we might not see it. But even as a normal person, we need to have coping strategies. Right? Because if I close from work from right now, after talking to you people for 1 hour, I might not want to talk to anybody else for the rest of the day. But yes, please help us with some of the coping mechanisms.
Good, but coming back to your first question, I think where are the sites or places that you will see to have information from this? One thing we need to know as Gambians, there is no information currently in anywhere that is serious that the public would consume and say, yeah, we are using this. Let's say Mental Health Act. How many of us have access to that? Do we even know where to get it?
I never know.
So information sharing is a problem in the Gambia. And so I think there need to be a system in place in order to be able to to unearth all this, because you cannot be serious in trying to talk about or sensitize about mental health when informations are not there. When you go to our country TVs, hardly they talk about mental health. The only thing is like you forcing your members or your people to only bank on the information they get from the internet. And which can be misinterpreted.
Yes.
Like anybody can do one or two things and then post.
They said if you put your symptoms, after 2 symptoms, Google may tell you
Exactly.
you have liver heart failure.
Look at that. Look at that. So many people might be a victim of trying to misinform themselves. But I think there is a need for the country to have a system where that is practical, where people can get information that they need. It is not only sitting at your office, but what is your office offering to the services that is offering to the people? Because that is one of the most important thing. So back to it is like for us, the No Health Without Mental Health. We have these social media platforms on Facebook, on IG, and on Twitter. What we provide is like we have specialists like nurses that specializes on psychiatric, and also we also refer to specialists.
Right.
Exactly. So what we do with you is like we refer you to someone that you can talk to, and then if the person feels that there is a need for you to progress from the stage that he is talking to you with, that you need to go further, then he can make the referral. But it is important that we know what is actually happening to us and the information where we can get it. Not all of us banking on Google to see this. Because people are running away from stigma. I think that has to come from community care. Like, I don't have to be selfish.
That is very...
Getting information and not sharing it.
See, no, the fact of the matter is, I like the point that you said, because
can I throw some light on that?
The whole world is evolving.
Can I just throw light on that?
And to a point, our generation does not feel too comfortable walking into healthcare settings, right? What Ousman said is really important. Having social mediums or having platforms that would actively talk about mental health, but also even lines that you can call just to find out information about mental health is really important. I can tell you one to Peace of Mind Gambia. I follow them on Instagram. Think Mental Health Gambia too is really helpful, which I both follow on Instagram. They put out great information about mental health. Even if it's not really related to you, just follow some of these pages as they put out stuff about mental health. Just keep learning about them. It might not be related to you, but it could be your sister, your brother, or some other person you would see outside that you can help. But before I come back to you,
wait, just give me a minute.
But yes,
wait. I just want to throw out on what you were saying, and it's really great that you actually mentioned Peace of Mind and as well think. And also, there are other organizations out there that we're working with.
Definitely.
So this was what was happening in the mental health field. I mean, it's divided into two departments. You have the clinical level that is at the hospital level, and you have the programs department. At the programs department, you have the community mental health outreach team. That in every country, these are the people responsible for any mental health victim that is roaming within the streets.
Gambia has 10,000 people.
Right. So this is why I really
done for.
Yeah, I'm coming. That's why I really want to share this.
I really know how to exaggerate too. But yeah.
So the problem that they had is at the programs office, the reality is not within the mental health department itself. The reality is within the government. So that was why with the NRC we had to actually pinpoint these things and draft it and recommend that on a whole budget at the ministry level or Ministry of Health, a lot of mental health is hardly factored out.
So
at a greater scale.
If I understand that technically there's no budget for
there's no budget for mental health technically.
There's no structure for it.
Exactly. So you can see the community mental health outreach team needs a multidisciplinary team that has to deal with a psychiatrist, a dispenser, a pharmacist, you name them. It's like a van that they have to be with securities that will be moving from point A to point B. If they see anybody with a hotline bling that you guys are talking about, those things are actually on the pipeline now. And we're working with the FSTH as well to build a website for people to access Tanka Tanka, not only within the country, but even internationally, because we always do receive calls from England, Sweden, or within the EU system. They are asking us, they want to send a client or a patient, a Gambian victim actually, back here. But it's not like a specific number. They will normally call the hospital PRO, that is Kebrasani, and then he will always refer back. So we're trying to cut that link and let it be directly under Tanka Tanka itself. So these are things that are actually working within the pipeline. So when it comes to other informations, mental health and psychosocial support is really growing, because IOM also, they're really into that. And regarding to data, we are not, I don't know whether you guys will understand this. You know, we have the HMIs and we also have the DHFIs, right?
The thing is, you're saying a lot of 3-letter words, and me and the people
viewers,
watching are going to get it.
Right, so you can, that is the health information system within the country, and the district health information system, where each and every department is asked to submit your data, your statistics, your articles and write-ups, And as Tanka Tanka, it's under a board. So you're not going to submit independently to these departments. You're submitting on the EFSTH. And EFSTH information department, or the record system, are the ones submitting to the DHIS. So it's like we're still not factored out like the way we want for people to understand. And we're still scrambling to like stand alone, so that a lot of the services that we need to give to the Gambian people can be clearly dispatched. Exactly. So this is where the whole issue is.
So I know when we talk about the structures, the problems, we're going to sleep here, right? But one of the most important things about this show is we know there are problems, right? We're going to point them out. But we want to move past the problems. So we're going to use this opportunity between you and Ousman. Teach our guest, people looking, the viewers, teach us a few of the mental health conditions. You can tell us some of the problems associated to it, some of the solutions, and you can decide in between the two of you. But at least, I'll start with Ousman. But he looked like he had something to say, which I cut out.
I have something to say. Like in terms of communication, sharing, and then creating more awareness to the people. But let us not look at it at the peripheral phase. These that we are using are only available people that are using social media. What about the people? What about my mother that lives in Khartoum, that has no mobile phone, that has no TV? How best can they get access to this information? So that is where the government comes in. Government don't, like, there's no system. That alone is a problem. And there has to be system for things to work. If there is no system, your ideas, these ideas that you are saying, they are all not going to work. People before you have thought about these things. Because there were no system, that is why they are still stagnant there.
I think the little bit of a good thing is Muhammad is actually saying they've been working on this.
It's already on.
So that's going to be in place. But like I said, the systems are the problems.
No way.
Gambia. We've been what? How many years have we been independent?
I mean,
if we're just thinking about putting some of these systems in place, that means when are we going to roll them out? When are we going to put them in place?
He raised a very important question.
Let me put that. So that set aside, I think there has to be channels that reaches to the Gambian people that are less privileged, because you cannot actually segregate between this particular category of people who would have this information and the other ones would not. What if the majority lies on the other side? What would you do? You just are accumulating people that are actually affected by these conditions that need to have access to mental health accessibilities, and also bringing into primary care the mental health services. The Gambia has that problem again. Our primary healthcare system is as broken as that. So we need to bring in mental health care deliveries to them, because they deserve as deserving as I am sitting here today, through the information that I need to have, and whether the accessibility is here for me.
Yeah.
Right.
So
It has to be decentralized
Okay, let me
and
just-
get to the community, the commonest people in our community that live. Because sometimes,
Right.
go to Tanka Tanka.
Right.
The people that, the patients there, where they coming from? Is it only within Combo? No.
No.
Some of them they come as far from Basse.
Right.
Are this platform available in Basse?
no.
At what level are they available?
If I think if we're talking about a solution, right, what I would think is, because I've seen it, I've watched a TV show called YOLO.
Right.
It's
Ghana?
just meant on raising, Ghana. It's
Ghana,
meant
yeah.
on raising information about
Right.
STIs, sex,
Right.
mental health, early pregnancy, just the things like that, right?
Right.
We could have had something like that, but since we don't have something like that, a part of that show, they showed that every hospital in Ghana had a corner called the youth corner. You
Right.
could just walk in
Right.
and learn about sex, learn about mental health, learn about coping mechanisms, and then
Right.
if you want a contraceptive, get it too. Well,
Right.
that's not the point of this conversation.
Sure.
But at least you can walk onto those places and you can literally learn about all the major mental health disorders,
Right.
even without having to experience any of them yet.
Right.
So yeah, that is really important.
So that's where I actually want to comment, and you just answered my question.
Well, since that is off the table then.
no, he said
yeah.
he said the peripheries, right? So the idea was, and it still is, we have like psychiatric focal persons in each of these regions. Let's say Basse, 2, Bansang 1, Buyam, and you name them.
Look at that gap. Basse to Bansan, just one.
Basse 2, Bansang 1,
Good.
then it comes down.
Then we are one.
You
skip
understand?
Janjamburi, you skip Bansa.
but
you skip Birgama Baso.
exactly. But that comes because we have like then again there are a lot of factors causing that as well. Human resources is one, because most people don't want to read mental health. That's another thing.
Yeah, but
Yeah.
like we said, we're
Yeah.
still gonna go back to the problem. They just don't think it's good for them to learn, or they don't think it's lucrative enough.
Right.
Or literally, if you've not been interested in mental health from since you were a kid,
Right.
there's no way you're gonna go to university and pick mental health to study.
Exactly.
Right? So that's there.
Yeah, but so information has been dispatched to like you said, the older people through community sensitizations and all of that. But then again, let me just say the problem still lies within. For the past 6 months, we're not able to do any tracks and community sensitizations because of the government is saying they don't have money, because these things comes with money.
Money.
Yeah, so this has been on the going since on the onset. But at the moment, I will be really honest with you guys. If I should count mental health specialists in this country, it will be less than 5 or 4.
Yeah, but the
Because
government is buying new pickups for non-members to roam around.
Exactly.
You know, but
that's the point.
that's the whole thing, though.
Yeah, it's
you
the
know.
whole thing. I mean, it is sad on our end that we're trying to do a lot, and the government is not actually reciprocating those same efforts.
I'm sure even the viewers, even us as outside there, we want to know about some of these things, because
Right.
literally we are a sad generation with a lot of cute photos on Instagram.
exactly.
So I know a lot of people, if these resources were available, they would really actively learn about these things. Muhammad, let me just take on to you still.
Sure.
Can you tell me some of the mental health disorders, at least some of the major ones, like depression, you know, and all of that? Then also I'll come back to you where you tell me some of the coping strategies. I'm sharing this. We're sharing this in half.
Well, let me just put it on our statistics. Gambia is affected mainly by, at the clinical term, drug-induced psychotic conditions. Let's say substance misuse disorders or substance abuse disorders. So it can either be weed, alcohol, or any of the hallucinogens. Recently, I've learned that there are cocaines and heroin in the country.
Okay.
And also, you know, the legend, they call it Ginabas.
Ginabas.
So
I'm yet to understand that drug itself, but I think is really, really serious how rampant drugs are on the street of Gambia now, and then how you could just get it, right? Because I've been to the clubs, I go to the club. It's normal. Nobody should be judging you. But when you do enter the club, you see how many people are smoking, how many people are drinking, and the pill. And some of those pills, and then there's another one called Molly. You could literally drink them and not sleep for 3 days straight. So, and then some of the times they literally pass out, and then the hospital is where they have to come to. What adverse effects does these actually have on people medically? Because you would understand that, and also, what does recovery look like? Do you ever recover from these, or does it just keep going? Or do you just keep getting addicted? Or you feel that vibe that they say is there, and then you just keep on going on it?
So when you look at drug addiction, it's very funny. In a sense that you keep taking these pills, you enjoy the funny moments that you have. I mean, you're not sleeping, you're high, and all of that. But the research is trying to tell you that there's no actually specific dosage that will actually keep you to be addicted to a certain level of drug. It depends on the consistency of how you're using it that makes you become addicted to the drug. So when you
so it's more like not how much you're taking, but how often you're taking
it. So that's how the consistency brings in the addiction.
I just realized some people might think, you know what? Let me take 5 pills every 10 days.
So,
it's not good still.
So
Go ahead.
So that's the thing. So like when you take this, let's say the commonest, like the Ross, clonazepam, has been in the system for so long. So when you take it, you start getting dizzy. You know, you're not seeing, and then you always have a blood spot that is your pupils are actually constricted, and you're not seeing like the bell, you know, because your legs are not actually functioning properly. So these are signs and symptoms that you actually manifest.
Now your motor neurons too are on the side.
It's on the side, actually kicking. So what it does is actually try to like, if your nervous system here is actually white, it will turn it to be black, just for viewers to actually understand. So what I mean is,
so what it does is, when you take the drugs, it totally changes the side to the opposite side.
Exactly. So the thinking, the way you see things, the way you perceive things, it's totally different from myself and Ousman, right? So you will always think that. And then one thing about drug addiction, you're always delusional. Most of the time.
You're always delusional.
You're always delusional. So, and that is like the signs and symptoms that you actually keep going with. So the adverse effects comes in is when you're actually, it's sad that we don't have a drug addiction center or a rehab center in the country.
Gambia.
But I will use examples like, let's say, the prison departments, because when they jail most of the drug addicts, they tend to pass through a stage of drug withdrawal because they are not having it as they were supposed to. The consistency has been like the change.
More like as they're used to.
Right. So now they'll be forced to experience these symptoms, like the seizures, you understand, like the tremors. At times you will see them, you know, kind of dyskinesia, you know, So you can name a lot of them. So that's where the adverse effect comes in. It changes your whole system, and through that stage, you're not going through what we call detox.
But you lack a wall of two. Because I think this is really important.
This
a lot of people are not going to get it in English. So new hako guy understand. Small number understand more if you take these drugs, obviously. So if you're mean to sleep on your left side, you're gonna start sleeping on your left side. So you also have on luba. Once you take these drugs, what it does is it has the probability of turning low muntineka luba permuneka lubon. More sometimes you meet up with some of these traits. Getting they get some parency in the streets, right? But you would see, because man, sometimes I think come to a level, some of the problems that people would have with other people until altercations, they gain argue you. At some level, magi lu dewa wareka so do already la drugs you do they am cliffa do they am cheer you don't have respect.
Cheer so, like because come no way saboti neka tunje guess like the way you're supposed to. So ko jele come saboti mungi dim mo neka like the constriction I'm saying. So warona hame Ousman ga fokko benen Ibrahim. It's not gonna work for you.
It's not gonna work.
So this is how it works, and at the same time come that they change a melokan. Understand? So nekon kurus like it shows the real you on the other side. So like people will actually take these drugs to be like to just show some of their inner characters that they wanted to show for a long time and they could not. And that happens most of the time with ladies, because we have seen that on researches a lot. So then it's not it come like
so more like the drug brings out your alter ego.
Definitely.
Interesting.
The drug addiction is one of the topics that we can talk about the whole day.
Right. So
With especially the amount of drugs that is in Gambia, that definitely is something we can go on for the whole day.
Yeah.
But always, please just tell us some of the coping conditions, because I would want us, to start wrapping up a little bit. Because if we put too much information into it, but yes, always please help us with some of the coping. I think it's really important before we actually go to the coping conditions for us to know some of the conditions.
Yeah, I was gonna list them.
And what their problems are, right? We will decide this into two, and then we'll have you tell us at least 3 of the conditions, or you also tell us 3. But hit us up with the coping condition, what the condition means, some of the problems associated to it, how you can do to recover from these things as well. But we'll also have you at least start with drug, since we've been talking about drugs. So the pills, the kubejara, I don't think is a part of it. But definitely the ginabases and then the pills and all of that, Maserati. One of them is called Maserati. Gao. But yeah.
Right before you answer that, I just wanted to throw this in. You guys you work with statistics.
Right.
Has the rise of drugs exponentially increased the
Right.
Well, how many Gambians do you think on the the statistics is important.
Yeah.
But knowing the number of drugs that is on the street, or how many people are coming in that are being affected, is really, really important.
Drug rise, more patient, right? In an easier time for
2022, from January 2022 to December.
Guys, you know. Alright.
Yeah, like from January 2022 to December, it has been a significant rise from 3% to 7%, making it 10% in total within the ages of 18 to 35.
To 35. So, well, that is kind of understandable, because Gambia, November, January is the semester period.
Exactly.
And that's when everybody wants to party, go out, do this and go that. Obviously, smoke, drink, do all of that. But what you're telling me is...
Those are just the new cases.
It was like 3%.
Yeah, 2. It's like 7%
increment. So just within the... And this is like...
Just last year.
Last year only?
Yes.
Well, if we put 10 years onto it, it might be 90%. But that...
and that is just...
And that's just few months.
That is just the new cases I'm just highlighting.
Yeah.
As per differentiating the older cases that were in the system and relapsing has also increased. Because most of the patients that were here travel, some of them are returnees, they came back and they also joined the cohort. That has also increased from 4% to 12%.
That's some of the deportees and all of that.
Yes. So like these are statistics that are actually affecting both drug-induced psychotic cycle.
So just before you move on to that, like let us not see statistics as that. We are living with these actually people
in the society.
There are spots in the Gambia here that you are there not to cross or to work around after Timis. Like you go to Bruford Beach. People are there in our communities. Where I live in Churchillstown, you see just 15, 16-year-old boys, smoking. Their physical look is just diminished. It's just down on earth like that. And we live with them in our communities. Like you go to Serekunda Market, you see people that you know that they are tough like stealing. So statistics are there, but our realities are just in our hands. We know them. We know that this is our problem. But community members, or community policing, I don't know whether we even have that. It is like we are appreciating them, because if we are not doing anything about to cut that growth because of this statistic number increment that you are saying, they live in our communities and we are not doing anything.
Yeah, because if within 3 months there is a 7% rise of drug intake, which I'm going to think is mostly because I know you've mentioned there's crack and cocaine in town.
Yeah, a lot of it.
I've not looked into it because it's something I would want to say is up on the rising. Right. So I would want to say most of this damage is just caused by pills, the weed that we're smoking. Is it the Gina bars, the skunk weed as well?
And the Zare as well.
Which one?
These names,
There.
we have to list all of them here.
But let me just quickly highlight before we wrap up.
Yes.
The commonest conditions. We have depression, and then we have schizophrenia, very common in our system. And
that's the one.
We have bipolar cases as well, very common in our Gambian system.
Yeah.
And then we do have perpetuate psychosis. Oh, I'm skipping 4. So, but you look at depression. I've already explained earlier that, like, when it's a mental health condition that is just characterized by, let's say, the commonest symptoms: sadness, withdrawal symptoms, and let's say hygiene,
loss of weight,
interest, and all of that. So those are like some of the commonest symptoms that you see. Yeah. And for women, most of the time, they might be eating a lot. If you're not like a foodie before, like you'll be eating a lot as well. And then some of them will be on bad diet, like junks, or clearly on just ice creams. And then research have shown lying down every time, being lazy, does not help with depressive cases. It always makes it worse.
So what would you tell us if somebody is depressed? What's your way? Where are you supposed to start working on?
Right. So the best thing that we're advising, because we are advocating for therapy and counseling and mental health and psychosocial support. So like what the individual should do is cognitive behavior therapy, that is talking on one-on-one. That's why where Peace of Mind comes in, think other organizations come in, because I know Peace of Mind, they have a very good therapy counseling sessions that you can book online, and you can actually have one-on-one. You talk about the problems, find solutions to it, and then try to put the person in basic adaptive life skills where the person is really good at trying to motivate the individual. And also the important part comes in the family support.
Definitely. Community-based is where actually all of the problems come from.
Exactly.
Because if you're being stigmatized at home, you're not going to get help. But if you're getting help at home, you're going to want to grow.
Exactly.
Right? So, yes.
So you need the family support. And here, that's one thing is, most of our victims going through a lot in this country, it's neglect by family. Yeah. You either have it through trauma, depression. When you look at it at one angle, the person has been neglected at an angle, either at work, at home, or an attachment, or a close relationship.
Yeah, I was actually going to bring up that point. I think it's really important that even at work now we start integrating, talking about mental health problems, stress. Even your boss just walking up to you to ask you, how can I help you be less stressful today? But no, the boss would rather sit in his office and drink his tea while you're outside doing all that. But yes.
And then if those things doesn't work for you, like I said earlier, on the classifications, the symptoms keeps growing. This is divided into 3: the social aspect, physical, and the behavioral aspect, or the psychosocial problems. Then if you're getting to the severe stage, that means you might need an admission. And the referral pathways in this country is you cannot just walk into Tanka right there. The reason being is we're trying to cut off the idea of institutionalizing patients. Because we want to de-institutionalize them via counseling and therapy. So they have to visit our their hospital outpatient departments. Like Canifin, for example, we have one polyclinic and all of that. So if they look at you at an outpatient level and see that you might not need the drugs or anything, they will refer you. So
but the only problem is if you walk into that outpatient, they might think your problem is solvable with medication. Because if I'm telling somebody I am too tired and all of that, I know them. They would say, Jelal vitamin C, Jelal glucose, Jelal Lee, for you to be active.
That's right.
To a level, it has to be that bag where you just walk in and know, I just want to go to the mental health. But I don't think...
Right now, we're still now having that. We're working on it. And I'm happy to say we're working because it's already on the pipeline.
Definitely.
Because we were able to come up with the GBV cases, and it's really working at the one-stop center for GBV cases. And I think you know about that. And other hospital centers now, you have the Jammeh Foundation. So we're trying to have a partnership with Peace of Mind and the UN system actually to build that up.
Yes. But let's go to the next case of mental health.
So when you look at schizophrenia, it's also the commonest in this country, where because of family inheritance and where family members are already having that most of the time, or genetically exposed, or you traveled and then you have psychosocial imbalances and all of that, like some of the triggering factors. But there are different types of schizophrenia as well. You have catatonic, paranoid, or you name them, the residual. It comes with a positive and negative symptoms as well. So those are the ones you clearly most of the time do see walking around the street. Like let's say catatonic, they'll be walking very fast and they're very aggressive as well. The hygiene is way off I don't need to talk about
They don't care about
yeah,
the
and they're
hygiene
way like delusional. But their delusionals are divided into stages. Is it delusion of fantasy? Is it delusion of grandeur? It depends on all these types. I can't really explain that to the viewers.
Definitely.
But these are some of the clear signs of symptoms that you can see. But when it comes to schizophrenic cases, once an individual is diagnosed with it, on the treatment guideline, therapy comes last. Because it's always on the severe stage. And also a lifelong condition, unlike depression.
Because I realized when you were talking about schizophrenia, you mentioned it could be genetic. So that means inheritable.
Inheritable.
Yeah. So definitely would be a more serious case than depression.
Yeah,
but
it's always a lifelong condition where you just have to be on drugs. But you can be lucky, preferably, if you're really good with not defaulting the treatment guidelines. That is, you're still sticking to the treatment protocols every month.
What you're telling me is some of the people on the streets that they could have a solution technically if they were taken care of the proper way and put on medications and systems and therapy. They could be off that and living a normal life once they're doing what they're supposed to be doing. That's something I think we all should learn and try to help the people that are out there. But yes.
So the third one that I will talk about is the commonest one again, bipolar cases, or we call them manic cases. That's like the opposite of depression. That most of the time happens with women, especially on statistics wise, where all the symptoms that you're having on depression is on the opposite side. You're having on the higher side. That is, it's always hyperactivity. Let's say if you are eating a lot, that means you will eat like you'll be eating a lot even more. Extra, right? So if you have that withdrawal symptom, it will be to the extreme side. So if you have like a low libido on depression, you will have a high libido that is on
depression.
No, on mania. On mania, that
it's
is the bipolar case.
Opposite.
Yeah, it's always, if you're having like a low mood swing on depression, you will have a higher mood swing. It's always the opposite. So that's the way you actually differentiate it.
But I think that's the one where security
exactly. Like the mood swings comes in.
Mood swings.
Right. So most of the time with these ones, before you get into the therapy or the counseling, you need to stabilize the individual's mood. It depends on a lower dose or a higher dose, because hence the mood is not stabilized. You cannot even have a proper counseling session with that individual. So you need to put on mood stabilizers like sodium valproate, clonazepams, and then you just stabilize the individual clinically. So then you can put the person on the counseling session, like the CBT or the exposure therapy or the imaginary therapies, and the person can actually.
Thank you, Muhammad. That was really, really helpful. Like you said, so daf amut.
No.
It just depends on the care you're having, which is really important, and how committed you are towards the therapy. It's good knowing that, and it's also good knowing that you could inherit it, right? So it's good to take care of people, but actually also take care of yourself. But we'll come back to all of that once I'm done with Mr. Ousman. Mr. Ousman, tell us a few more conditions as well.
All right. So since he delved more into
more disorders
that are common and medical, let us not forget we have more socially things that can get to that psychiatric or mental health level. We need to understand that there are stressors and equally buffers equally. And stressors can be economically, can be culturally, it can be it can be from so many things.
It can be violence, it can be physical trauma.
From our culture, think about gender-based violence. Think about things that people go through at home. Think about things that people endure at the time when they would be there, and then they can no more take it. They have to get out from that shelf and then try to act otherwise. And then from there, the society will try to stigmatize. The society will try to label them as a person of, let's say, idiot or mental health person.
Lunatic.
Exactly, all those things come. So one thing, it has to do with you understanding why that happened to me. If it is a gender-based violence, you need to talk about the problem at home. What the things that factored out to that. You talk about it, you bring in help that can get you out of that situation. Is it going to be the community member? Is it going to be, you start with the family. Is it going to be the family that is going to take you out of that? Is it going to be the community leaders? Is it going to be your how to call it, your district? Like, there are people that you can actually inform about a family settings, that if you're being violated at home. So there are channels through that. Also, there is one we call personality disorder.
Right.
Recently, not just within the Gambia, but worldwide, people are trying to gender themselves. It is a wide topic that probably we don't want to talk. But these are realities that people are going through on their daily basis. Like, why should you subject yourself to certain exposure, to certain pointing figures?
Gender phobia.
Exactly. If you know that it cannot work. Let's say you are a man and you want to be a woman. In the Gambia here, the setting, if we can talk about mental health or supporting mental health here against tomorrow, but the people, your people, cannot accept that kind of realities. So these are mental health topics that we need to put to light equally. Exactly. We don't need to forget about them. We need to understand that they are within our midst, and probably they need support. If it's all had to come down to talking, being open up to certain conversations about yourself, about your emotions. Like, come out and then, you talk. But then, again, the question is, the person, maybe the person or the individual you are talking, the stigma would start from him. So there has to be a system that people can trust. There has to be a system that people can, entrust their life with. And then coming back to personalized things, like you as an individual, there are stressors. You trust on your buffers. Like, you have this self-compassion in you that you can try to accept things. It's only at another level that if you cannot hold it, if you cannot endure that pain, if you cannot endure anything that you are going through, that is when you try to behave, or altered behavior comes in. But so long they are on the primary level, like, you have the opportunity to talk to someone, please do. Talking is our problem, but let's try to talk to people, our friends or family, or any other professional that we believe we can talk to. So it has to do with you accepting what is actually happening. Acceptance matters a lot, and then try to build from that. You know the problem, you accept the problem, and then you build from the problem,
and then start finding a solution.
Exactly. So there has to be a level as to how you best exactly. So we need to find out through that, again, with the help of the system that works. So I'm still punching you on that. No, you people are the specialists.
Accepting it.
You have all the reason, or you have all the right to push this, because the people on that cohort, their lives matters. And then you are the people, or you are the pivotal people that people can, or people think you are the ones to help them. Aside from the community help, from the family help. Understand? You are the focal points that they need to, their problems, how to help them. The community can only do a little. If the community cannot solve, and then they goes to you. So when they are at your level, you also need to establish ways that they can be better, but not from
bad to worse.
That is something that cannot happen, and probably we would not understand. You come into the clinic and you are, one or two things, then the people that you come in to seek help from did not help you, but rather worsen your
condition.
The condition through the social factors that surrounds it and all that. So I think as Gambians, we need to redefine our status in terms of mental health, in terms of accepting, and in terms of trying to be open up to certain realities. Like, we talk, let's bring more platform. The government, they are the center of this. They need not to neglect. There are funds. There are funds there. So they cannot just say there are no funds. There are funds. We just have to redirect fund to where they exactly should be. Mental health is really good. If not, because these statistics that you are saying, they are actually coming from our communities. Our younger brothers are there altered.
The age gap
Whatsoever.
is what again? 16 to 35.
Exactly.
Yeah,
Right.
And
ages
they
of-
are growing, and they are growing violently. They will take your phone from you if you want. They
Chapel and
snap
knock.
you.
And they will start
Exactly.
you, yeah.
And they don't move in. They move in groups.
Right.
Sometimes you would just saving your life. You would just want to surrender. And, you keep your life. If not,
Definitely.
they'll be violent on you.
Right.
And then maslah be feel it. They feel it. They get ku rain it. You take 1 year, 2 year, and then the next year you see the
And
person
then
on the
outside.
street. What is that telling us?
It's not worth
we are
anything.
not safe. Our lives can be just like that.
Can end
then
at-
the next
at any
day-
minute.
Exactly. So it has to come again to community care than just individualized care. As a community member, I have to show care,
Right.
talk to my younger brothers,
Right.
if need be. Invite police. Wherever you saw a gang of young kids, smoking, call police. Ask them to come. They disperse them or arrest them.
Right.
Yeah, these are some of the things that we need to be looking at, but not just key domi killer go buy to your head. So yo sabunta bila mo the car daji and then steal from you if not violating you, but
No, in as much as
Yeah,
even the
sure,
violent
sure,
part is as important, right? But if we see people doing that from early onset, pointing out some of those problems might be the reason why they would go, let's say, seek help or want to even change or even want to stop smoking as much.
Right.
Because sometimes you also have people who tell you smoking is what keeps them.
I guess the bush lawyers, man, or the bush advocates.
But let's leave that. But
Yeah.
Mohammed, let's have you tell us some of the few advices that you give us before
Yeah.
we wrap up this whole thing.
Most of the time, I will always say in any platform, and I'm glad that he actually already mentioned that. I'm not going to go through it again.
Yes.
That nobody, it's everywhere in the world, is immune to mental health.
Nobody is.
Yeah, we just pray that your destiny does not call for it. And then mental health is not one person's show. I stand as an advocate, as a mental health specialist, and also as a community service, giving back to the community. I mean, mental health is everybody's responsibility, and everybody should be involved in it. Right from the drug law
Enforcement
enforcement
agency.
agency, DLIC, I always tell them, I always call them, I always tell them, the prison department, we call the justice department, the National Assembly as well, and also the National Human Rights Commission. So these are bigger bodies in the country, and also the Ministry of Health.
But you people are not involving the local person in this. And that might be why it's not working yet.
Yeah, but of recent we are with the help of the National Human Rights Commission. Last time we always have workshops with them where they involve all these big stakeholders, and everybody is trying to take up responsibilities. But then again, it depends on how and when will the government and the ethics committee of, I'm saying it again, the ethics committee of the National Assembly to take responsibility of actually implementing everything that we have advised them to and recommended to for the Gambian citizens.
Well, we've learned a lot
Yeah.
on the segment. We spoke about at least a few mental health topics. Mr. Muhammad has given us statistics,
Right.
also is telling us how it feels dealing with mental health on a community level.
Right.
We learned a lot, even part of which we've realized in 3 months, the number of people with mental health problems or drug-related mental health problems is rocketing from 3 to 7. That's in 3 months. 10 years from now, if you multiply 7 by, that's 70%. So we can tell in 10 years, 73% of Gambia could be at the risk of being drug abusers or being falling from the streets because they're abusing a lot of drugs.
16 to
16
35.
to 35, which is really sad. But in as much as this is the reality, the other reality is a lot of us are going through depression. He rightfully mentioned we call them doves. It could be better for them. So just as we would do for those people, but it's very important for ourselves to know what are the right ways to get over stress, understanding ourselves to a point where we would know if we think we're affected mentally, and then go to someone to talk to. They've said a lot of agencies here that you can talk to. We've said a page that you can follow to learn about a lot of things. But also it is very important, even the people that you talk to on a regular basis, that's your friends, the people you talk to on WhatsApp, on Snapchat, even on YouTube, sometimes log in and just go learn about mental health. It's important as much. But some of the things we can do is exercise, go to the gym. You can sleep more, drink a lot of more water, because it's always helpful. Go sightseeing, explore. Learn about these things, do things that interest you, and sometimes give yourself that kick. If you're depressed and you cannot do anything, the one thing you can do is at least find someone to talk to. Because they've said a lot of therapy here, but necessarily therapy don't mean you walking to Mr. Muhammad to talk to him about your problems. You can even go to the beach and just talk to yourself. Sometimes faith is the solution to some of these things. Pray about some of these things, but it's really, really important. And then we've learned a lot of things with regards to mental health. I'm sure Muhammad would be available, both Ousman and Muhammad, anytime that you have questions or anything. You can always drop it on the Daily Dose email or on our social medias, and then we'll put you in chain with some of these people. Thank you for joining the segment today. Tijan Sinyan again. This is the Daily Dose Plus.